Is there anything more important than health? Ultimately, anything you care about comes down to health. Whether it's wanting the best healthy long life for your loved ones, or even some capitalist magnate wanting to live longer so he can hoard more money, health is what we should all care most about. And what doesn't connect back to health? From issues around gun violence, the opioid epidemic, climate change, to education, life-saving and extending technologies, and economic development, public health is an integral part of everything we do and care about. In this video, I'd like to talk to you about an organization that strives to bring the advances in the world's healthcare to the people who need it most globally. This is a Project for Awesome video about partners in health and how they're helping us meet lofty goals for the future of global health. For my usual viewers who may not know about the Project for Awesome, it's a multi-day online event started by John and Hank Green in 2007, where thousands of people upload YouTube videos about their favorite charities and raise millions of dollars for them while also taking part in a really goofy 48-hour live stream. This is my 12th year making a video for the Project for Awesome. You're watching FutureNow, videos about the future of tech and society. Where do you even start when measuring the progress of global health when there are hundreds of nations and billions of people worldwide leading fairly different day-to-day lives? Thankfully, this very question is what led to the creation of the Sustainable Development Goals, adopted by every member of the United Nations. They are 17 lofty goals covering everything from eliminating poverty to world peace and, of course, public health, with a target of achieving them by the year 2030. Sustainable Development Goal number 3 is to ensure healthy lives and promote well-being for all at all ages. This goal is itself broken down into 13 distinct targets, and each of those has its own indicators to track their success. You cannot achieve these kinds of goals without putting in place systems, and that's precisely what Partners in Health is so excellent at doing, and why their work is particularly effective. Partners in Health works directly with and within every community they serve, by both sending in trained professionals and hiring and training local people to improve health outcomes in their own communities. Partners in Health is the kind of organization you want to support in a crisis, because they are there before the crisis hits, and the people doing the work on the ground are often directly impacted. At the height of the Ebola outbreak in West Africa, Partners in Health hired 2,000 locals in Sierra Leone and Liberia as support staff, community health workers, and orphan caregivers, alongside the 200 healthcare professionals that deployed to the area. This included 600 Ebola survivors themselves that were hired. Partners in Health understands that you don't tackle long-term issues with short-term solutions. You cannot effectively help a community without first gaining their trust, listening to them, and only then truly providing what they actually need, not what you think they need. When you support Partners in Health, you are supporting an organization that recognizes poverty as the greatest determinant of poor health, and as such provides excellent healthcare alongside economic and social development to help lift these communities out of poverty and empower them to progress without the need for continued external support. Partners in Health also has a research arm in partnership with Harvard Medical School and Brigham and Women's Hospital to continue to innovate and bring these new approaches to healthcare directly to underserved populations around the world. We need organizations like Partners in Health to reach our ambitious sustainable development goals. The future of humans depends on us all working together. It is unconscionable to hoard medical advancements for only the wealthy of the world when there's something we can do to alleviate suffering of others. Thanks in part to organizations like Partners in Health, the maternal mortality ratio has declined by 37% since 2000. Their approach to a reduction in women dying due to complications during childbirth are multifaceted, from providing access to family planning, which alone can reduce the mortality rate by 1/3, to providing medical care during pregnancy and childbirth, and treatment for mothers with HIV. There's still so much work to be done if we are to meet the Sustainable Development Goals by 2030, so I urge you to find out more about their work at pih.org, and if you're watching this the weekend it was released, go to projectforawesome.com to check out more videos about charities and help raise funds through the weird but wonderful perks on the Indiegogo. All funds raised during the first half of the P4A will be split between Partners in Health and Save the Children. After that, money will go to the top charities voted by you. I'll see you in the future and in the comments. DFTBA.